Hi there, I'm Dr. Davis, Chief Medical Officer of PreventScripts. In my 18 years of outpatient pediatrics, I felt powerless to help my patients and families stick with the lifestyle recommendations I made in clinic. I would tell them what to do in their visit, what to eat, how much to exercise. And when patients returned to clinic the next year, they gained 10 pounds rather than lose any. Many patients progress to full-blown disease in what we call the blind spot of healthcare. So here's the problem for primary care docs. They're experiencing decrease in revenues. The Blavatnik Institute reported average losses per primary care doctor of $65,000 in just the months of March, April, and May of 2020. We are experiencing increased responsibility for patient health outcomes, yet we have no training in how to actually change patient behavior. So for primary care docs that are looking to establish a service line focusing on prevention, we are a tech-enabled primary prevention platform, enabling providers to systematically identify their motivated patients and offer patients insurance-covered custom digital interventions. So here's how our platform works. First, patients complete an assessment pre-visit. We color code their risk and biometrics, priming them for a prevention conversation with their provider. Second, our algorithm ingests survey data and sends a custom intervention recommendation by secure direct message in real time for each clinic patient. Third, using the AMA's in-reach quality improvement strategy, patients are onboarded into one of 3 tech-enabled interventions while they're still in the office with their provider. Our remote monitoring platform pairs the latest in connected scale daily self-weighing research with passive activity and nutrition tracking to maximize patient engagement between visits. Our prevention counseling platform nearly automates the shared decision-making 5A approach for providers to help patients pick which behavior they want to focus on changing each week. And then our tobacco cessation text platform informs patients of their options to help them quit over a 19-week period, encouraging them to come back for a follow-up visit. We started with performance-based pricing so we can better understand the true ROI of our product. Our long-term goal is to transition to tiered SaaS pricing per provider for an unlimited number of patients. This year, we raised $220,000 in pre-seed financing from the Bluegrass Angels and the Commonwealth Seed Capital. We partnered with the University of Kentucky Department of Family and Community Medicine for a strategic non-dilutive funding strategy at NIH and NSF. And we signed and implemented our first customer, a 9-provider clinic with 4 sites in Tennessee called Covenant Cares. So companies like Amada Livongo and Fruit Street sell to consumers, employers, and payers, leaving no revenue generation for providers. We use a suite of contracted insurance codes for provider-based revenues. The closest model to PreventScripts would be Remedy, which is a downstream chronic disease management product for sicker and end-stage hospital patients, whereas we implement in primary care offices in upstream and younger patients. I help grow successful physician networks at Doximity and HealthTap. Brandy, our CEO, won the prestigious Kentucky Medical Association Award for Advocacy in 2018. And Jay built, grew, and sold an internet service provider while he was still at college, and since has been developing for companies like Walmart and Nike. We truly have our dream team of physicians, value-based care experts, behavior change specialists, designers, and commercialization experts on our team. We've come a long way, and we're excited about the work ahead of us. So we're seeking a strategic healthcare lead investor for advice and capital when we open our growth seed round to maximize our opportunity. Thank you so much.
Thank you, Natalie. Great job. So tell us a little bit more about the seed opportunity. There are a lot of seed investors on this call today. What are the top reasons that you feel that PreventScripts is a differentiated seed investment?
Well, we have a proven team. We have an in-market tech-enabled service, so we do not require any regulatory hurdles to get to market. And we have a very robust nonprofit funding strategy and partnerships. Um, we are a capital efficient female founder led business, and we are a true quadruple aim investment because we're automating prevention and behavior change for providers. That provides the steepest possible cost reductions to be found in healthcare. And this is also the biggest market there is. The provider health IT space is projected to grow to a $64 billion market.
That's awesome. I love the real provider first approach, which is not surprising, given that you yourself are a provider. So given the way your business is ramping up, what are you most excited about coming into the new year?
We're really working on ramping up our nonprofit research project with the University of Kentucky, and we've identified a couple of more grants that we're going to go for. So we've got NSF as well that we're going for, and we have an R18 that we just identified, which is an ARC grant, an AHRQ grant that is a 3-year project that will be very exciting for rolling out our product in a Kentucky population over a 3-year period. So we're super excited.
That does sound exciting. And one last quick question before we move on from Andy Geese. Do you have any validation on engagement and retention rates?
We are just onboarding our first group of patients into our remote monitoring platform since launching our first customer. So we have just come up on our first month of remote monitoring